Is the screen visible? The slides? Can somebody answer? Is the screen visible, students?
Can see me.
Okay, right. So we are still in the learning objective. Last week, can somebody tell me what we studied? We are starting a fresh new lesson today, but can somebody recap quickly by taking at least 30 seconds to 1 minute what we really did last week? Can somebody tell me?
We did risk management.
Right. We did risk management. Yeah, but actually we had to stop by the time we studied the risk management. So today we will learn a lot about, how we can actually do all these risk management in healthcare. Like, so let's just try to sort of pick up from what we did last week so that we can sort of remember again. So the first point is, what is risk management in healthcare? So like last week, we told risk management, it comprises the system and process employed to uncover, mitigate, and prevent risk in healthcare institutions. So any kind of risk that can happen in hospitals, in any workplace, we need to know what are the risks and how we can mitigate it. So I'll quickly go with this slide, not to waste too much time here, so that you all can recall it, right? So risk management in healthcare compromises clinical and administrative system trained to identify, evaluate, and mitigate. Like now the word mitigate is very important because we have to know how we can sort of prevent this, what you call risk management, right? How we can prevent sort of risk that can happen in a workplace, right? That is the main idea about risk management. And how the HR has its role, the managers, how they have a role, the doctors, the nurses, anybody who is working in a healthcare sector, they need to know how they can manage the risk in the workplace to prevent the people who are working for them, and also to prevent risk from that is going to occur in themselves, right? So this is the video that I actually wanted to show you all, but I think next week I want to make sure that we have a little bit more students so that they also can like participate, because it's quite an important video, something that I do not want to show through a recording. But so let's just skip this slide for the time being, and let's go through why risk assessment is important, right? So for example, if we want to see the first point, why risk assessment is important is because we need to like identify the hazards. What do you mean by hazards? Can somebody tell me what do you mean by hazards, students? What kind of hazards do you see in a risk in a workplace? Can somebody answer?
There are so many hazards.
Very good. Like, can you tell me? For an example, in a okay, go on. Sorry.
Yes, in working place, there are chemical hazards like and biological hazards.
Good, very good. Yes. So those are all the hazards that can happen. So I think you really summarized everything. You said about medical, biological, like so many hazards that can take place in a workplace. Yeah, that's correct, right? And then I told you last week that this OSHA requires, they are the people like they will conduct, they can do like a yearly audit or a monthly audit to come and see if the workplace is actually functioning, where the risk assessments are being like monitored, if there are proper measures that are taking in a workplace so that the people are not in danger. Right, so that is one thing. OSHA also does that. And the other one is Environmental Protection Agency. We call it EPA. That is actually, you have it in the US. So they specialize in assessing the hazards related to humans and its environmental receptors like animals, chemicals, and other ecological factors. So like now, even though we are learning about healthcare management, like you need to understand, like I even said last week, this risk can happen not just in a lab or a hospital. It can happen anywhere, right? It can happen in a school lab. It can happen in a cooperative sector, right? So every place needs to know how they can mitigate these risks. So if the USA is specializing through the EPA, there is also in the UK where they conduct risk assessment, which are legal requirements as stated in the Health and Safety at Work Act, where they will also go through certain policies to see that okay, these places are functioning without any risk. Okay, but these are the risks that is happening in these places. So we need to be alerted. We need to be informed. Okay, so that is why risk assessment is important. So if somebody asks you in a very simple question, why is risk assessment important? Is because we need to make sure that the people who are working and also yourself is actually protected from any kind of harm, danger, or hazards. Is that understood, students? Before I move to the next slide, because we did this last week, so that's why I'm speeding up just to recall your memory so that you will remember where we left. Is this understood, students? Students, yes or no? Hello.
Yes, miss. Only I am answering, miss. Please ask from others.
Yes. Actually, the thing is, I can't see the screen while I'm teaching, so I'm unable to see. Yes, Taranga, thank you for answering. Students, the rest of you all also please answer. Okay, please answer, because otherwise it's like I'm talking to a dead body. Like I'm talking to myself, right? So when do you perform risk assessment? So the first thing is, beyond complying with legislative requirements, the purpose of risk assessments are to eliminate operational risk and improve the overall safety of the workplace. So now, if somebody asks you, or if you have an assessment, if somebody asks you, okay, when do you perform a risk assessment? Usually risk assessment is performed by an auditor, someone like a sponsor who comes to, and monthly check the workplace or yearly check the workplace. We'll come to see, okay, this place, these are the kinds of risks that is happening. Okay, so if there are risks happening, we need to eliminate. We need to have an operational system. We need to assign people to see if these places are having, proper risk mitigation, what do you call, plans. Are they having proper, what do you call, signs and signals to say these chemicals are corrosive, these chemicals are toxic, these roads are slippery, this building is under construction, so don't pass. Like, risk assessment is another whole job role, right? And it is a must. So now see, the first point is, they say, when you perform, the first one is new process or steps are introduced to the workflow. So let's say, for example, you are building a COVID, let's say a COVID department, right? Because of the coronavirus issues are going up, a COVID situation has come, so they want to open a COVID ward. So what kind of things that they can look into this ward before they open a COVID department? What are the things that they will look into? What kind of risk that they need to mitigate? Can somebody answer? Students, last week, as I said, you all need to cooperate, because it's actually it's not nice, because when I ask a question, you all need to answer, and I'm not going to scold or anything. සිංහලෙන් උනත් answer කරන්න ප්‍රශ්නයක් නැහැ. අපි COVID department එකක් අරින්න plan කරනවා නම් මොන වගේ දේවල්ද අපි කියන්නේ සාමාන්‍යයෙන් හිතන්න ඕනේ? මොන වගේ risk අපිට එන්න පුළුවන්ද? What kind of risk can we get? How do we like mitigate it? Can somebody answer in Sinhala even? It's okay.
Environment.
Okay. Like in a sense, what do you mean? What kind of environment?
Yes, COVID is a very පැතිරෙන එකක් නෙමෙයි, so we have to be careful about the environment.
Careful. එතකොට ඒ කියන්නේ එතකොට ඒ වගේ ward එකකට අපි මොන වගේ දේවල්ද මේ introduce කියන්නේ මොන වගේ risk එන්න විදියට කොහොමද අපි ඒක මේ mitigate කරන්න පුළුවන් විදිය? Can you tell me some ways we can mitigate if you are going to open a COVID department? Like, what do you think you need to provide? What are the signs you could put?
We can put the.
I didn't hear. Repeat again, students. හරි අපිට පුළුවන් ද ඕන කෙනෙක්ට මාස්ක් එකක් නැතුව gloves කියන්නේ මේ safety equipment අරින් we can ඇඳගෙන යන්න නැතුව can we tell them, oh, you can walk anywhere you want? You can't, right? So you can put certain signs. Wear your mask, check your body temperature before entering the department, right? It's because a highly contagious area. So can you see those are like you are assessing the risk that can happen to a people when you're opening a COVID operational unit. Understand? So it can happen to any situation. Or for example, let's say a lab is being opened where a lot of corrosive or cancerous chemicals are being used. So you will say these are the chemicals that are toxic, these are the chemicals that are corrosive. So you will put certain labels which are toxic and corrosive so that people know how to use it, when to use it, when not to touch it, like that. Risk assessment. These are situations when you are performing a risk assessment. And also the second point, changes are made to the existing processes. That is another thing. For example, I'll tell you, usually a lab, let's say that you are not using, let's say, toxic or cancerous chemical. But let's say because for a research purpose, you have to bring toxic and cancerous chemicals. So during this situation, because something new is coming to the workplace, you are going to now bring some awareness to the people. Cancerous chemicals are used in the lab. So stay away, wear double gloves, wear the mask to prevent inhalation. Like that, you need to sort of bring in new introduction when you're trying to carry out a risk assessment. Is that understood, student? Right?
Yes, and PPE, no, Miss?
Yes, PPE. Like that, students talk to me. Then I also feel motivated to teach y'all. I want y'all to like discuss karana math එක. එතකොට තමයි interesting. හරි? Third one එක අපි අලුතින් equipments or tools when we bring new equipments or tools or new hazards arise. අපි නිකමටත් හිතමු, for example, let's say usually අපි කරන lab එකේ සාමාන්‍ය microbiology lab එකක් කියමු, suddenly contamination එකක් වෙන්න පටන් ගත්තා. There is a new contamination that has come into the lab. A new bacteria has entered the lab and now all the patient samples are getting contaminated. That's a new hazard, right? So what do? We need to bring an autoclave. How many of you have seen autoclave? දැකලා තියෙනවද autoclave එක? Where do we use autoclave? People who have worked in the labs, do you all know what an autoclave is? Do you all know what is an autoclave, students?
No, Miss.
Right. Autoclave එකක්, I'll just explain. සාමාන්‍ය autoclave is an equipment that works under very high pressure, right? If you now, for example, usually an autoclave you will find in the Durden's lab, especially in the microbiology department, even in the dental area. Now, when people clean our teeth or when you are refilling the teeth, sometimes they can use the same thing, same equipment that was used for one patient. Like if someone used it for Taranga, same equipment can be used for somebody else. So now that can be not clean, right? Because of course, everybody has microorganism in the mouth. So to prevent this contamination, they actually need to sterilize these equipments in a high pressure equipment called the autoclave, right? Autoclave. So that's a new equipment. Usually you need to have in every lab. In Sri Lanka, I have seen it. It's like usually you have to have it, like even to prevent HIV/AIDS or hepatitis B, right? Because to prevent the risk of diseases from one person to the other, you need to sort of autoclave these equipments in high pressure or high sterilized equipment. So when you're bringing autoclave also, it's a risk because they say when you're opening autoclave, you can't just quickly open because at a high pressure එකට if you open කෙනෙක්ගේ මූණ දිය වෙලා යන්න තරම් ඒක හරිම dangerous equipment එකක්. Just like how it helps to sterilize the equipments, it can also for the high pressure, if you open without knowing how to use it, people can die. So if you have bought a new equipment like an autoclave to sterilize the tools, it's a risk, no? You need to tell people how to operate the autoclave, what is the purpose of using the autoclave, how to on it, how to off it, how to clean it. So this is another thing that comes in mind when you need to perform a risk assessment. So if somebody asks you, what are the situations that you are performing a risk assessment is, first one is when you are introducing new steps to a workflow. Second one is if you are making any changes to the workflow. Third one is if you are bringing like new equipments or tools like the autoclave, just remember, then also you need to bring in a risk assessment because anything that you are trying to do, you have to always make sure that you are not at risk and the people who are working in this environment is not at risk. So this is the main focus of a risk assessment. And if somebody asks you who performs this risk assessment, is usually a company or an auditor. Externally, because සාමාන්‍යයෙන් if you are saying now we have let's say a company called say what do you call, let's say M&M company, a pharmaceutical company. So within the company, the manager can't, usually the manager, while he checks, you need to have an external auditor, because sometimes the manager can be biased. He can favorite the people who are working in his company, even if they are doing mistakes. He just wants to cover up everything, and okay, come on, you can tell, it's okay. He just wants to cover up just to save his company. So he might be hiding. That's why every company will have an external auditor, because they are unbiased. They will never favor it. They will see, okay, is the manager looking into the people who are working under him? Is the manager aware that these kind of things are happening? That's why you need to have an external auditor, just to see if the workflow is happening efficiently and also risk free. Okay, is that understood, students? Yes or no? ප්‍රශ්නයක් තියෙනවා නම් මොනවා හරි දෙයක් add කරන්න තියෙනවා නම් please add and you can ask. Hello students.
No, miss.
Okay, right, next one, we are going to learn a difference between the risk assessment and a job safety analysis, or JSA. Can somebody, now today I'm putting the slides with the answers so that you all can sort of like summarize and tell me, how do you identify a risk assessment and a job safety analysis? The answer is already there in the screen. If you can explain to me in your own words, how would you explain it? Students, what kind of things what do you mean by a job safety? How does it differ to a risk assessment? If I ask in simple question, how does a job safety differ to a risk assessment?
Identify the hazards.
Okay. Yeah, so what do you think the hazards could happen to you in your job? What kind of, like, let's say you're doing a job, what are your hazards in your job place? Can you tell me? Just tell me that personally something that you have faced in your job. It could be anything, any kind of, what is your job safety and what is it, how does it differ to your risk assessment? Just say what is your job safety, what kind of issues that can happen to you in your job.
When we are using computer so long, so it is risk now for our eye.
Very good. Okay, it's not a safe thing, because that's an excellent answer. If you are using too much, if you are someone who have to work on the laptop for a very long time, say at a stretch maybe 2, 3, 4 hours, it's your safety is being jeopardized, because in the long term run, the blue rays that is emitting from these equipments can cause a harm to you. And what about any risk assessment that you can have in your job place? How does that happen?
And also, miss, we are sitting in a one place. It is
Mm-hmm.
also the that our sometimes back pain also happening now.
Very good. That's right. Sometimes people can have problem because of the spine and hip position, because the way they are sitting, they can have bed sores, you can cause injury to your spine. Sometimes, some people they say ඉඳගෙන කාලා වැඩ කරනවා කිසිම like there is no movement to the body, like you're going through a very sedentary lifestyle, right? So as a result you can get obese, right? So these are all where your job is being jeopardized. So if I go to explain now, they are saying risk assessment are often confused with a job safety analysis or job hazard analysis. So the key difference between a risk assessment and a job safety analysis is scope එක කියන්නේ how well we see them as to distinguish the two things. So for example, they say risk assessment will assess the safety hazards across the entire workplace and are oftentimes accompanied with a risk matrix to prioritize hazards and controls. I will explain, don't worry. And whereas they are saying job safety analysis is focused on job specific risk and are typically performed for a single task, assessing each step of the job. So I'm so proud of the people who answered here. most of you all said that about, prolonged usage of computer, sitting position. This is exactly what you mean by job safety analysis, because it is something that is typically performed for a single task. Samaning, when you are doing a job, you are just focusing, okay, getting this blue ray from your laptop screen is a single task. It's a job unsafe thing that is happening to you, right? But when you look at the risk assessment, it is about the safety hazards across the entire workplace. So if you are saying that, let's say there is a what you call a voltage shortage in your lab, in a microbiology lab, that can sort of be a huge problem to the entire what you call microbiology department. Because just imagine there is a shortage in electricity and that some place can go for a fire, or the whole workplace can shut down, the equipments can shut down. So like it's a huge risk. So risk assessment is something that focuses the entire workplace, but job safety analysis is actually on a single task. Okay, some people have a like problem with the blue light emission. Some people have an issue with single task in sitting always in the same place. They don't have time for the washroom or for their meals, or even to just take a small walk, nothing like that. So that is why they say you need to understand, if you are working, how is your job, or maybe you're having somebody next to you who is always harassing you with bad words, or he's harassing you physically, or he's not letting you do your job. Can you see, it's just a single task, right? But if you take a risk assessment in a workplace, let's say if there's a shortage in electricity, or a voltage shortage or something like that, the entire workplace can happen. Or for example, let's say like there is a, how to say, another one, like say somebody has come who has got Ebola. So the entire workplace is now at a risk, because it's a contagious disease, or COVID. It's a contagious disease. That's why when the corona came, when one person was positive, people through fear shut down the entire department, or they made everybody get quarantined who were got associated with this person. So the risk assessment is like the entire workplace. But job safety is like for you personally, what are your issues? Like just because next to me somebody is harassing doesn't mean that entire people's job is going to get affected. But for me, it is a problem. You understand? So you need to know how the risk assessment and job safety analysis differs. Okay, right. So next we are going to learn is varieties of different risk assessment used across industries. So now, for example, they say risk assessments are essential to identify hazards and risks that may potentially cause harm to workers. So every assess why we, if somebody asks you why do you need to assess the risk, because we need to know what are the risks that can happen, what are the harmful things that can happen to the workers, right? So then they are saying there are varieties of risk assessments. So we are going to look at each four of them one by one. So the first one is health and safety risk assessment, right? So I will go now question by question, one by one. So let's start with, let's see. Let's start with Sanduni. Sanduni, can you read to me the first one? Health and safety risk assessment. You can read it and can you explain to me what you understand? So I'm going to ask now question by question from everybody. I'm going to call out the names so that everyone has a chance. What do you understand here from the first point? Health and safety risk assessment, what do you mean? හරිම simple. කියවලා තමන්ට තේරිච්ච විදිහට කියන්න. ප්‍රශ්නයක් නෑ වැරද්ද වුණත්. I'm not going to scold anyone. Only I need your active participation. What is the first point? Sanduni? Sanduni, are you there? Okay, I will go to the next one then. Roshan, can you answer? What is health and safety risk assessment? Students, now how do I know that y'all are actually in the lecture? So y'all can mute because y'all can go off video. This is the only way I know that y'all are physically present in my lectures, right? That's when I'm actually asking questions. Okay. Okay, then going to the next one. Tilani, can you answer that question? What do you mean by health and safety risk assessment?
Sorry, ma'am, I have no idea because I am just joining the class.
Okay, no
Sorry.
problem. No problem. Okay, so I will take you to the next question. Okay, then I have no problem. Taranga, then can we start from you? Just read it and let me know what you understand. What is health and safety risk assessment?
What the risk we can face in the workplace?
Like how? Examples?
Like now we can face to the that is it very noisy place? So it it goes to some issues to work.
Like how? If it's a noisy place, okay, you can say, yeah, that's right. Some people can find it hard to sort of focus, right? Pay attention, concentrate, right? People who have certain, mental disorders, sometimes a noise can be a little bit of a trigger point, right? So that's good. Thank you, Taranga, for answering. So the first point, health and safety risk assessment is a type of risk used by safety managers, okay, like the manager who is in charge of the workplace, right? To determine what are the health and safety risks associated with the job. So let's say I am the manager for a microbiology department and all 5 of y'all are working under me. So it is my duty to understand what are the harms and risks that can happen to all 5 of y'all by working in a microbiology lab. First thing we know, HIV/AIDS is a disease caused by a microorganism, right? We know that. Tuberculosis, right? So I know that all 5 of y'all are gonna be getting sort of exposed to patient sample. So patients of TB can come to y'all to give samples. Patients with HIV/AIDS can come to give samples. So it is my duty that I have supplied with sufficient gloves, sufficient protective equipments and dressers, so that you all don't get exposed and your health are not going to get jeopardized. That is my, as a manager, I need to know that my employees are going to be safe based on this risk, and I need to know that these risks can be identified either biological, chemical, energy, environmental, anything. So biological is mostly like getting exposed to HIV virus, tuberculosis virus. Chemical is, I know that you all will be getting exposed to very toxic and corrosive chemicals also, because in a lab you have toxic corrosive chemicals, you have toxic corrosive biological samples. And energy, for example, maybe you all are working with very high voltage equipments, so that which uses high energy supply, that you can get into a situation where your health can be in danger. And environmental, maybe I know there are a few people who are not nice to you all, maybe there are some co-workers who are bullying y'all or who is not allowing y'all to do. So as a manager, I need to know that y'all are happy, y'all are safe, that y'all can carry out your work without any problem, right? So that is one thing. As a safety manager, I need to identify what are the risks that can happen based on biological, chemical and energy, and how I can mitigate this risk. That is number one, right? Let's go to Danusha. I'm not sure if I got the name of Danusha. Workplace risk assessment. Can you answer? What does that mean? I explain now the health.
If any employee get sick or something, we can encourage.
Very good, very good. Can you elaborate a little bit more? Yes, okay, we can encourage them. Okay. Why do you think we do this?
If they want to that physically and mentally, they want to prepare, no, ma'am.
Yes, excellent. Thank you. Thank you so much for answering. That's a very good answer.
Okay.
Every employee has their right to get a sick leave. If they are genuinely sick, say they came, very healthy, but suddenly they got a temperature or their pressure went down or their sugar got up, you can't say, oh, no, you can't go home, you have to work. No, that is their right. We have to, and other thing is, I told you, like, I think 2 weeks ago also, people don't really understand someone who is going through mentally. Right? Only, especially Sri Lankan mindset is when somebody falls sick physically, they think, yes, this person is really sick. But what if they are going through mentally? That person may be coming to work thinking that, when they go back after work, they are going to attempt suicide, So if you see if you see your colleague or if you see another person mentally down, as a manager, as a HR, as a colleague, you need to ask them, are you okay? How are you feeling? You need to ask them. And the sad part about mental disorder is people can really pretend like nothing is wrong, because society has made it look like if you are mentally sick, that it is something like, you're really a mad person. This is a very bad thing, I need to emphasize, which is very, very wrong. Physically sickness and mental sickness are both the same. You can't say which is great or which is minor. No, both are equally detrimental. Many people can get mental sick by losing a loved one, or they are going through a physical sickness. They got to know that they're having a cancer. They are mentally sick because they are worried how long they have time to live or how they are going to afford for chemo. So, which is why kindness and empathy is a very important thing. So workplace risk assessment, the office manager or the people who is in charge of this place need to identify, okay, if they are going through something mentally or physically sick, they have the right to take time off. Sometimes a mother who was pregnant lost a baby, right? So, she's going through a miscarriage, and some people's grievance, they take time. So you need the workplace area need to identify them and, empathize with them and help them to get through the situation. And it's their right also to sort of get this moral support. As employees, they have that. Okay, they have the right. So that's a very good. I think Sanduni, can you just guess for the third one? What is fall risk assessment? The answer is there. You just need to read and just explain to me in your words. It's okay if you make mistakes. Just want your active participation. That's all. What is fall risk assessment? Students, Sandini, are you there? Okay, I think she's not there. Okay, Tilani, can you answer for me? What is fall risk assessment? This is the only way I know that y'all are actually physically, they are in the lecture, otherwise, students, it's not, these lecture slides, I also I have to read, I need to summarize. So, it's not easy to make slides, right? So you need to make as per the syllabus. So I can just, like I said, I can just read and finish the session. But when you all are doing assessments, assignments, sorry, when you all do active participation, it's very easy to answer the question, which is why I try to get you all to participate so that you all remember and you all gain confidence to answer, right? So make this an opportunity to speak, to ask, to answer. Just 2 hours, right? So what is fall risk assessment?
Can I, miss?
Okay, no problem. Any volunteers? Yes, please go on.
Used to find out high risk of falling, miss.
Of who? Of who, Taranga? Good answer. Falling of whom? Mainly, who are the people who are more risk in falling?
Old people
Excellent.
and pregnant
Elders.
pregnant mom.
Elders, yes, excellent. Yeah, that's very true. The thing is, we should not say, oh, only the old people have fall. Of course, young people can also fall, which is why every time there need to be a post or a sign to say, please do not cross this area, don't trespass this area, because the road is slippery, the area is slippery, there is danger, there is construction. So if you are not aware of it, Even the young people, even in their teens, in their youth, can fall. It can happen to anyone. But here mainly, for example, the older people who have, like, rheumatoid arthritis, osteoarthritis, osteoporosis, their bones are quite, fragile, not so steady. So they have a higher tendency where they could fall. So to prevent this fall and danger that can come arise, we need to sort of have a risk assessment. So the nursing staff, the moment they see an old person entering, the nursing staff need to sort of, help them to walk to the destination where they need, or if they need to use the washroom, if they're a bedridden patient, how they need to support. So healthcare management, like I said, it's not an easy field, but it's a very rewarding field. It is a field that needs a lot of patience, tolerance, empathy, kindness, understanding, like all those highly emotional intelligence qualities are needed, right? That's the field, because you're dealing completely with very vulnerable people, like Taranga said, pregnant women, old people, right? So can you see, even within the risk assessment, how the risk assessment is being classified under certain subtopics? First one, we learned about health and safety risk assessment. Second, we learned about the workplace risk assessment. Third, we learned about the fall risk assessment. Can you see? Risk assessment also needs to be classified as per its situation, right? The next one is construction risk assessment. So let's see, Shehara, can you answer? What is construction risk assessment? This the people I asked question, are you guys actually there online, or Sandhani and Shehara, are you guys there or gone away? Any volunteers who like to answer construction risk assessment? What does that mean? I even explained this just a while ago, and I've explained this.
Risk of risk or chance that some injuries happening in the construction place.
Very good. So what do you think we need to do, Taranga, in that situation? What is your opinion? What do you think we need to do? What is your opinion? How can we prevent it?
We have to put the sign here, this is under construction and like that.
Excellent, excellent. So I feel only one student is actually paying attention and few others. So she answered exactly like I said. Yeah, when there's a construction, I think we have all seen when we pass the road, slow down, constructions is ahead, 2 kilometers, the construction is ahead, the road is slippery. So like that, it's a risk assessment. So they have found out, because there is a building construction going, people who are driving that area need to slowly drive, or people who are walking that area need to take another alternative route, right? So that is another thing, right? Okay, so those are the different risk assessment that we discussed, right? Okay, hold on. Okay, right, now let me just so now we are gonna again like sort of summarize it. If somebody asks you, how do you analyze a risk, or what are the 5 steps for a risk assessment? So we are going to learn first of all based on the points, and then we will actually learn a little bit step by step, right? So the first one is you need to identify the risk. Second one is you have to analyze the risk. And third one is we need to evaluate the risk. And the fourth one is we need to treat the risk. And the last one is we need to review the risk. Can somebody take a minute? I'm going to give you 1 minute. Can you bring an example where we can put all that in these 5 points? How you identify, how you analyze it, how you evaluate it, how you treat it, how you review it. I want everybody to take 1 to 2 minutes. Think about a scenario, and based on a situation, how would you classify them under these 5 points? I'm going to ask from one by one person an example. You can make use of this diagram, and you can even make use of these 5 points, and then I will explain to you. We will take 2 minutes to understand how we classify an example based on those 5 points. Okay, so I think now let's ask, first of all, Danu, can you tell me the answer first? Can you give an example how you can analyze it based on these 5 points? What is the risk that you thought in your head? Anything? Any risk, any place that you think of?
Road there's an accident.
Okay, good. Okay, what kind of accident? Thank you. What kind of accident?
Accident means the vehicle, not the person, the vehicle.
Okay, can you bring a little bit to the healthcare management? Let's say like you're in a hospital. Can you bring an example? It's correct what you said, but if you bring it to a hospital, can you give a scenario?
Fire.
Very good. Okay, a fire. So that is you identify
Yes.
there is a fire. What do you think the
Oh,
why? Okay, sorry, go on. Okay, there is a fire, but just one question. What do you think would have caused this fire in your? Let's say now you're the auditor. You saw there's a fire, so that is now a big health risk. There's a fire going on. Why do you think this fire arose? Why do you think that it came?
I analyze the where's the fire is starting.
Ah, excellent. You are analyzing where the fire is starting. Very good. So that is your second. So you identify the risk is there's a fire now, and then your second you're saying where is the fire starting. Third one, how do you put it?
Yes.
How do you evaluate the fire?
I put that fire, the kind of there's a variety of fires, Mama. The wire shortage, then oil leaking, that variety of.
Excellent. Okay, very good. And the fourth one, how do you treat the risk? How do you do it now? How do you act on it?
I identify the varieties that if the wire shortage, we can put that soil or something. That what we call that fire, something soil. Where we can put the soil noise.
Yes. And the last one, how do you review the risk?
I call the fire brigade.
Very good. Okay, excellent. So thank you so much for that. Before I give my example, can we have another volunteer? Anyone else who can think of like that to put it in? Just a see, it didn't take 1 minute, right? Any other people who can? Roshan, Shehara, Sanduni, anyone can answer an example? Just in 5 areas, how you all can classify a risk. Someone said fire. Anyone can answer? how you classify? No, it's very easy. You just have these points and you have the diagram. How would you assess a risk? So these are the
Yes,
essays that you can get. Okay, yeah, so, yeah, go on. Sorry.
yes, in my working place, I found that some infection is going on.
Very good. Okay, that is your identification of risk. Excellent.
Yes.
Okay.
So I identify those. Yes, I identify that it is harm for my staff as well as the visitors.
Very good. Very good. Okay. Okay. Right. Go on. How do you evaluate it then?
Okay. First, I I I put some poster everywhere. So this infection going on. So you have to wear the mask and wash your hands when you are coming inside. And also I sanitize all the workplace,
Excellent.
all the areas.
Excellent. Well done. Well done. Right. That's good. How do you treat that? And you also said how you treat it also, right? So that's good. And lastly, how do you review it? How do you review it?
That mean review. What is that mean? Means
Yeah. So
last one.
yeah. No. Thank you, Taranga, for answering that. So review is like how you can like for example, review and modify the risk assessment is like what are the changes that can happen in a workplace, right? Like how can you bring what you call changes to mitigate that this risk will not take place further in that environment. Like I think you also answered that, like telling everybody to wear a mask.
Use
If
the PPE.
yes, exactly. So actually the same example that I thought of is what Taranga already answered. So I actually appreciate very well, excellent work there. So again, if a little bit modification of exactly what Taranga said is, easiest thing is an infectious disease that is happening in your workplace, Ebola, COVID, anything. So that is the identification of a risk, because it is a big risk, because it is a contagious disease, which means it can spread from one person to the other person. And then analyzing is you analyze that it can be harmed to anybody, to the people who are coming, to the people who are working, that it can be harmed because it's a contagious disease. And the third one is you're evaluating what are the methods now you can prevent this COVID within your office. So first of all is you tell everybody who got exposed to this particular, let's say John, who had COVID first, whoever spoke to him or whoever had contact with him, everybody needs to get quarantine, right? Everybody needs to stay at home for 7 to 14 days. That's the first thing you do. And the second thing is you actually sanitize the whole place, the workplace, everything. You shut down for a week and you sanitize everything. And before you resume work, you tell everybody wear face shield, face mask, carry a hand sanitizer with you. Those are all, evaluating and treating. And finally the review is you need to bring awareness by posters saying, okay, the COVID situation happened in this area, therefore we need to be a bit more careful. We need to have like signs and posts saying in the lifts, if you are going, try to keep at least 1 meter distance apart. Don't stand in the lift facing face to face each other. Put some posters about before you enter in the workplace, check your temperature, wash your hands, sanitize with your hands. So all this is what you do based on identifying, analyzing, evaluating, treating, and then you review it. Can you see how interesting it is? How, if we as humans, we have so much within us, the human brain is so developed, how we can sort of mitigate when you identify there is a particular risk. Now, I like the answer that Danu also gave. She said about a fire. Very good, because a workplace, a fire is also a very big issue. I think that is more dangerous than COVID also, because imagine you can die on the spot. A building that catches fire, before giving awareness for the next situation, maybe the whole building could catch fire. So if somebody could identify that, oh, there is a shortage in the upper building because of electric shortage, you quickly identify it, you quickly get the electricians, the architecture quickly to come sort it out, so that the fire or nothing gets, it won't catch fire, and you do the construction properly, you tell the people don't trespass this area. So different scenarios, how you act, you identify what kind of risk. That's why I always said, is it a biological risk? So Taranga said about a biological risk, and then Danu said about a environmental, like something like environmental chemical risk. So you need to know a workplace can have so many kinds of risks, which can be classified as biological, environmental, chemical, electrical. So each classification, how you act and how you bring a solution is going to be always different, right? So that is very, very important. So thank you both of you all for answering. That's very good. So I hope other people also can think of more examples to identify based on these 5 points. Okay, so excellent. Right. Let's go to the next slide. Hold on. Right. So the again, like we are going to now a little bit talk a bit in detail. Like for example, these are the points that I will elaborate more. Like first of all, let's say when you identify a particular danger in the workplace, first of all is you identify it as a hazard. So they say survey the workplace, look at what could reasonably be expected to cause harm. Identify common workplace hazard. Check manufacturer or supplier's instruction or data sheets for any obvious hazards. Review previous accidents and near miss reports. So, for example, this is like they are trying to say is like, what are the obvious hazards that can happen in a workplace? So now what Taranga and what Danu said are obvious hazards that can happen. A fire can take place. An infectious disease can happen. Any other hazards that you all can think of, students? Other than fire and other than infection, what are the other hazards that you all can think of? Can you all think of something else? In India, actually, there was a big situation that happened where there was a chemical that actually got mixed with the drinking water. It happens very much in Asian countries. Sometimes oil spillage, right? When that or when, for example, people who use groundwater. So in those areas, if near the groundwater, now actually when I was in Japura, I was actually working on a research of where in the ground well water, there was a dump site at Navina dump site. I had to check if the groundwater near this garbage dump site was getting contaminated. And when I did my research, I found out there were fecal matter, there were coliform like bacteria, the nitrate level was high, the phosphate level was high, the nitrite level was high. So these are hazards that was happening to the people's groundwater because of a Navina garbage dump site. So that's another hazard which I think we can think of, because both of us, like all of us, we spoke about a biological, we spoke about a fire, but what about toxic chemical, cancerous chemical mixing with people's drinking water? Or even, for example, toxic, let's say compost, fertilizers, if it's getting mixed with harmful toxic substances, people's food are going to get harmful, and what you eat is going to get harmful, you can die, right? So every situation you need to identify the hazards, and these hazards, even though we're learning in healthcare management, you need to understand that it can happen anywhere, but we try to keep the hazards within the healthcare sector so that we know what are the hazards that can happen in healthcare. Now, even for example, let's say that you are working in a hospital. Now, your hospital, next to your hospital, you have a, let's say, a company. That company is like, say, manufacturing plastics. Usually when you are running a hospital, they try to, as an architecture, they try to find a place that like it's not it's not a contaminated area because people are very conscious that the patients are not, under threat. But if you take the Kalubowila hospital, actually the Kalubowila hospital is right next to the road, right? So people can sort of raise concern if there is a lot of, emission of, vehicle emission. Right now, Sri Lanka doesn't have that because we are not having many road cars or vehicles. But, usually, let's say a hospital is located near a very traffic congested area, people can raise concern, oh, this heavy traffic is emitting a lot of, carbon monoxide, carbon dioxide, and there is a lot of air pollution. Patients are going to be, under threat, because of these bad pollutants that is getting emitted from these vehicles, which is close to the hospital. So you need to know, like, what are the kinds of hazards that can happen, which is very, very important. And you then make a checklist, right? And then they're saying these hazards. Yes, dear. Yeah.
Physical as well as psychological hazards also can happen, no, miss?
Yeah. I mean, physical, psychological, you can't call it a hazard, dear. You can say that hazards can cause somebody to go through something physical and mental. Do you get what I'm saying? Hazards are usually biological, chemical. It is usually environmental, but you don't really classify them as physical or mental. But we can say a hazard can cause somebody a physical issue. It can cause a mental issue. So, for example, let's say if you are always working in a very noisy environment, it can cause somebody's mental situation to go really bad. Like they can't focus, they can't, like, if somebody is already having anxiety, the noise is like always disturbing them, they are feeling very agitated. So that is a hazard, no? That machine is emitting so much of noise and so much of toxic gases is causing somebody's mental well-being to go really bad. Physical loss, the same thing. Chemical hazards can cause a physical harm to you. Toxic chemicals can cause a physical harm to you. Is that understood? Was I clear there?
That is not a hazard. That is the cause of the.
Right. That's a cause of a hazard. Exactly. You can't really say physical, mental hazard. You can say due to chemical, biological, environmental hazards, somebody can have physical and mental problems. It can lead to physical and mental risks. That's what you have to say. Hazards can cause physical and mental risks. Is that understood?
Yes, miss, got it.
Very good, right. So that's what they're saying. Hazards and risks are sometimes used interchangeably. However, they actually refer to two different elements of potential incident. So a hazard is something that has the potential of causing harm to people, to the property or the environment. Can you see, Taranga, what they say? This is exactly what I tried to explain. It has potential to cause harm to people, mentally or physically, or even to a property. Like, for example, let's say, like, if like Danu said, if a fire arose, it is a problem, right? Because the whole building can, get, it's a property damage, right? So much of money that was invested to build the building, and if a fire suddenly took place, the whole property is like damaged, it's gone, right? Where you need to build up everything from scratch, from everything from beginning, right? So that's why you need to always know, you identify a hazard based on biological, based on chemical, based on those factors, and those hazards can actually cause harm to people, mentally, physically, property-wise, and so on. And once you identify the hazard, we need to evaluate the hazard. So these are all like the previous slide, which we spoke on the first 5 points. It's just that we are elaborating a little bit so that in case you all missed certain points, it's just a catching up, right? So you have to consider how, where, how much, how long individuals are typically exposed to a potential hazard. Now, say, for example, someone said, looking at the laptop for a very long time. How long are you being exposed to the laptop screen? Is it extremely like 2 to 3 hours at a stretch? Or let's say that you're working with a toxic or cancerous chemical. How long are you getting exposed? Are you using this chemical every day? For how many hours? Is it every other week or every other day, every other month? You need to know. So based on this, you need to identify, like, risks and hazards are like very, very important, how you identify and how you evaluate it. Right? And meanwhile, you perform an environmental analysis and you gauge potential risk and the impacts on your business environment. So for example, let's say that you are using this chemical called ethylene bromide. Ethylene bromide is actually quite a toxic chemical. So somebody who is like a manager who is running this company knows that everyday exposure to ethylene bromide can cause cancer. So let's say somebody of his employee is working with ethylene bromide, he should be aware, okay, this particular person, let's say John, ethylene bromide, he's using it every day. So as a manager, it's his duty to sort of, either put some other people shifts or provide him with the protective equipments, in a way that he is not getting exposed. Much as possible, we must not, actually, in my opinion, we must not say, this will actually help you to reduce. No, this should help you to not get exposed at all. That is the correct way. That you need to see that your employees are protected. You can't, the manager has no right to say, oh, if you wear the gloves, you will get exposed, but you will get exposed less. That is a very wrong thing. That is a very wrong thing. You must try your level best that this person doesn't get exposed at all, Like, for example, the needle prick of HIV person, you have to give a double good glove so that the person doesn't get needle injected at all, because one prick from a HIV person accidentally going to your body can give you HIV AIDS also. So the employer, the manager, should take the full responsibility that his or her employees are fully protected. Because what happens is, supposedly, that let's say that a person, someone who got, because there were no protective equipments provided by the company, they can actually take them to courts, to the law, and dodge a complaint and say, my rights were violated. I work with no protective equipment. Even though I requested my employer to give it to me, he said no. You can sue the company, you can sue the boss. It can, because it is actually depriving a human right, right? And the third one is, you decide on control measure to implement. Like, so after assigning a risk rating to identify the hazard, it is time to come up with effective controls to protect workers, property, civilians, environment, follow the hierarchy of controls in prioritizing implementation of controls. So, this risk assessment is a very, it's a complicated, even though we just learn by points and theory, when you actually do it, it's a lot of, you need a lot of intelligent people, you need a lot of management, you need a lot of money to really, handle the situation, right? So like when Danu said about the electrical shortage, how do you do it? You need to bring architects, you need to bring electricians to, stop that. If you find out a COVID, how do you do it? Like, you need experts to identify. You must not let the people panic. You must handle the situation very sensitively, right? Just because somebody got COVID, you can't be insensitive to their feelings. You need to sort of say, okay, you're sick. We need to sort of help you to take some time off until you get better. How you become kind to them. And after that, how you help the other people to stop the spread of the disease. So it's a lot of coordination, like mental, physical, emotional. So any workplace is a lot of coordination. How you do things mentally, physically, emotionally, it's a lot of everything together, right? So there's a lot of success when you combine all of it together, right? Okay. And then you document your findings. Like, so for example, let's say Danu found a shortage of, there's a fire that is taking place because of this particular situation. Or Taranga says, okay, there's a COVID situation. So you need to document your findings. So Taranga, let's say, was a manager in the company. She is the one who first found out, okay, there was a COVID patient. You need to say, John was a COVID patient. He showed COVID symptoms on this particular day. He was interacting with other employees. You need to write down their names. When did they eat together? What were the symptoms? What are the things that happened? Where are the other places that he went? Who are the other people he came in contact with? So all these you need to document. Like in clinical research also we say, especially when I was doing a clinical trial, if I didn't document anything, that means nothing what I did really happened. That much documentation is very, very important. right? Anything you need to document, whether usually in Sri Lanka, we are still in the, but not so much in the technological era, we still go for the paper. Document mean you either put it in a database, like in a computerized manner, or you write it. You have to document when it comes to risk assessment. Where did you find this hazard? What was the reason that it caused? So you basically classify them based on those 5 points, but you need to document. So when another hierarchy person comes, he will ask, okay, give me all the things that you found out, so that when you have a discussion as a board meeting, you have facts, you have evidence that this actually happened and this was a reason that it happened, right? So without, like, for example, let's say somebody wants to go to the airport. How do you know without a passport he's like, this is his real age, this is a real person? You can never cross a port without a passport, right? You need to have a document. That's why they say when you are going, make sure that you carry all the document. That is the evidence to say that this is you are who, and your name, your age, your country, what is your profession. Like, for example, if you don't have your degree certificates or anything, how can we prove? You need to like get your university seal, everything to prove that actually you have a degree from this particular university. You need to have evidence. So everything you need to document your finding. And the last is you review your assessment and you update if necessary. What do you mean by you review your assessment and then you update if necessary? What does that mean, students?
We have to get back and update.
Yes, okay, yes. Why do you think that's important, students? Why do you think that is important?
We have to tell it to the that third person, like hospital, or we have to give the information. No?
Yes, excellent. මේ අනිත් ළමයි මොකද්ද මේ කතා කරන්නේ නැත්තේ? Taranga is the only one who usually answers. Why, students? Do you think I'm strict? Have I ever scolded any one of you all? I never scold, right? Usually, I never scold. I will be happy even if. See, only 4 students now. What happened to the 3? Only 3. There's all left. What happened to the rest of the students? Taranga, what happened to the rest of the students?
I think in Sri Lanka today we are having internet issues, miss.
Very sad, no? Ayo.
Yesterday also we had problem with the current situation. I think today also.
No, I also feel, because when I ask them, I think they are online either because of the network connection, they can't talk or they can't hear, I feel, no? It's very sad now.
Sometimes.
Right. So all of your, so is it because of the power cut? How many hours, Taranga, now power cut is in Sri Lanka?
2.5 hours and again 3 hours.
Yes.
5 hours. All together 5 hours.
Okay. So hopefully I will see what I'm sad because I'm talking a lot of important facts today and like only 3 students, Okay, let's see, because that's one of the reason I think I will not do a Kahoot quiz also, because I feel it won't be fair for the students who are not there today. So let's see, hopefully. And Taranga, y'all are only free on Sundays, no? Y'all are, none of y'all are free on Saturdays. It's only on Sundays y'all are free. Is that so?
Can manage. You can ask from others.
Yeah,
you send the message then.
Yeah, let's see, because I don't know, and I think I was also not sure whether I could have the lecture because of the Eid and all, and actually I am actually taking time from that also. I'm doing the lecture because for me doing the class is important, so it's okay. I'm actually very sad because only 3 students. Usually we have around 8-9 students, like today only 3. Okay, no problem. I hope they will watch the recording. Let's see, let's try to do something next week. Okay, so you follow up with your assessment and then you see if you recommend what are the controls that you can bring in to sort of, mitigate this risk, right? significantly. So like when you come to COVID, you see that, okay, by hand sanitizing, by sanitizing the workplace, by wearing double mask, you could see that the spread of the disease is now slowly going down. And as per Danu's electricity matter, after getting good electricians and technicians, you could see now, okay, there is no shortage and it's now safe, everything is going okay. So can you see, once you follow those 5 methods, you can bring everything back to normal. So that is why identifying the risk, after identifying what are the steps that you carry on, how you do it, it's all very, very important. Okay, right. Right, next one, step-by-step process to carry out a risk assessment. So again, this is a little bit different to what we learned, but it's almost a little bit same. But we are just going to ask some questions. Like, so for example, they say, risk assessment should be carried out by competent person. That's what I told you before also. A normal person cannot carry out a risk assessment. It's just like to give a drug, either a pharmacist or a doctor should actually recommend. A normal person can't say, okay, you take 300 milligrams of this particular drug for your this disease. No, you cannot do that. Someone professional who is specialized in that particular area, who is competent, need to be carrying out a certain task. Because now a fireman to douse a fire brigade and a fireman needs to come. A policeman cannot do. That's right. For each task, you have each specialized person. So just like that, for risk assessment, you need to have someone competent, someone educated. What do you do? How do you do it? What are the ways you mitigate it, right? So to start off, a good planning will be essential. Anything in life or anything in any situation, you need to have a proper plan. Once you have a proper plan, how do you execute that plan? Third one is, once you execute that plan, you see, okay, are the results coming out from this particular plan? If not, how do we change the plan? What are the things we need to add? What are the things we need to eliminate? So it's a lot of mental game, like a lot of mind work, right? So here they are saying, anything to carry out a risk assessment, you have to follow the OSHA, okay, Occupational Safety and Health Administration Policy. So this is very, very important. You have to carry out the OSHA policy. So the first one is, what is your scope? So when you say what is your scope, you need to know, okay, what resources do determining the scope when planning a risk assessment can help you figure out, like what resources you would need. Now, for example, again, I'm coming back to the COVID and the electricity. When you have a shortage in electricity and if you want to stop this fire, what are the resources that you need? We need the resources of getting proper electricians. We need a proper, let's say, to reduce the fire, we need to have like fire tanks just in case if the fire really goes on. And like, we have to have some exit emergency areas where people, can exit fast without any block. And in the case of COVID, what are the resources you need to have, like a proper mask, proper protective equipments, you need to have, those are the resources. And then we need to be specific about what you're assessing. Is it a biological risk assessment? Is it a environmental thing? Is it a chemical? You need to assess then your resources, right? So that's a lot of, planning and analysis and how you carry it out. And the second one is, you need to determine the kind of training, right? Now, so for example, I think somebody who is doing basic life support, I think, is it Taranga basic life support course? I'm not sure who is. Yeah, yes. So now for the basic life support, usually like, okay, let's say a paramedic, let's say 911, you have to call a 911. You can't call the police when somebody's having an emergency heart attack or a stroke. You can't call the police or you can't call the next door neighbor. You have to call a paramedic, because why? They have that special training. When somebody is having a heart attack, how do you do a CPR? How do you do a resuscitation? Okay, so you need to have the training, and only the paramedics will have those special tools to bring that, to do the CPR, that air gas machine, the equipments, right? All that. And you need to like determine the risk properly. You need to analyze, okay, this person is now going through a heart attack leading to a stroke, or this person is having this particular situation. So you need to understand those situations, right, before you assess it. And who is involved. Right now, for example, if a doctor is involved to protect the patients, it is the doctor's role to make sure that, COVID is not getting spread to other patients. He need to sort of like, bringing some, sort of awareness to other patients. If you got contaminated by this patient, try to get quarantine or take this particular drug for 7 days, try to keep your immunity strong. A doctor will do that. Or if a fire started, the fireman will come and say, okay, we need to do this, we need to do this. When this happens next time, do this, like that. A fireman will do. So each task will be assessed by that particular person who is specialized to carry that particular task. So this helps you to identify additional resources that can improve the effectiveness of your risk assessment. Is that understood, students? Like how you carry out a risk assessment. So today, if I am to summarize right up until now, we learned about what exactly is a risk assessment. Then I told you how does it differ to a job risk and a general normal health hazard. Then how do you carry out based on the 5 steps? So you all gave me like a good example, how you identify, how you analyze it, how you review it, how you mitigate it, right? So all this time we were talking about all kinds of risks that can happen, not just in a healthcare place, but outside, but we try to narrow it down mostly to a healthcare environment. And it can always be either biological, chemical, or environmental. And if that happens, how it can affect a person's physical being, mental well-being, right? All that. Any questions, students, right up until now? Do you all have any questions? Students, any questions? Okay. So at 6 o'clock, I will actually, it's in Bangkok. Actually, it's 6. It's going to be 6. I think for y'all, it's going to be, I think, 3:50 or so. What time is it for y'all, Taranga?
4:20.
Sorry, 4:20. Okay, 4:20. Sorry. Okay, so I will at 4:30 Sri Lankan time. I will try to go through the Kahoot answers because most of you all wanted to know the correct answers because last week we did the quiz, but we didn't go through the right answers. So hopefully other people can watch the recording to know the right answers as well, right? So coming back to this slide, if it's a step-by-step process to carry out a risk assessment, we need to know what is the scope, we need to know what you need and who is involved and so on, right? And the next one is what are the laws, regulations and internal policies you need to comply with. So you understand last week I told you, can somebody tell me what is non-compliance? Can somebody remember the word non-compliance?
Do not follow the rules.
Very good. Excellent. And what happens if you don't follow the rules, Taranga? What happens then?
Problems happening.
Exactly, like everything. Like I said, compliance is very important because without rules and regulations, people can behave like really in a unethical manner, in a really uneducated way, and the whole workplace can sort of get corrupted. It can really malfunction, and everything can collapse, right? Just like what's happening in our country now, right? So that's why rules and regulations is a must. And when I say rules and regulation, it's not just for the people, but for the people who implement those rules and regulations also need to follow, right? So if the doctor is implementing certain rules for the people who are working under him, he too needs to follow certain rules and regulations so that the whole workplace is going to work efficiently and honestly, and end of the day you really get both of them win. It's like a win-win thing. That's the whole objective about compliance. So that's why we have laws and regulations, internal policies that we need to comply with. Compliance is a must because even when it comes to health risk assessment, we need to follow compliance, right? Because otherwise you cannot mitigate a risk. You need to follow regulation. Like I said, OSHA regulation, we need to follow. So those 5 steps that all of you all classified an example is based on that, right? Because they are correctly saying what you need to do. How do you identify? Once you identify, what are the steps you are doing? So that's why compliance based on regulations and internal policies is a must. so that you can actually conduct a risk assessment and you can actually mitigate the risk assessment. Okay, so that's what they say. By determining all these, you can create a solid foundation for an effective risk assessment. And once you plan out your risk assessment, you can proceed with performing the risk assessment. And risk assessment is performed in 5 steps or stages. So these are the 5 steps and the stages that we actually discussed, right? So if you to summarize it, this is the one: identify, analyze, evaluate, treat, and review. So that's like a summary. So if you understand a risk, what is it and how it's happening, anyone can sort of classify based on these 5 processes. Okay. Now we are going to learn about hazard versus risk, right? Let's see. So the hazard is, this is something with the potential to cause harm. For example, soiled bed, linen or clothing, spillage of bodily fluids and assisting people to move, like many things can be a hazard. Some people told about like a fire is a hazard, like, you know, getting contaminated with a infection is a hazard. Anything that is going to cause a potential harm, that's the keyword, right? Next one is the risk. What is the risk? The likelihood of a hazard causing a harm. For example, picking up an infection from a soiled bed lining, or slipping on fluids from a spillage, or trapping injuries from using a hoist, right? So, for example, you see there is okay, let's take a simple example. When you are going in the vehicle, you are seeing a sign in a billboard saying, when you are going on the right hand side, there is a slippery road ahead of you. So if you pass that, you can get yourself into a damage. Now you saw the hazard. So if you have common sense, what would you do? You would still go in that road, or would you take the other road? What is the common sense?
Take the other road.
Exactly, you take the other road because you have a risk. If you take the same road, you can get yourself into an accident, you can even die. So that is the two things. Hazard is finding out or knowing there is a problem, there is a harm that can happen to you. Risk is if you don't take proper measures or precautions, you can actually get yourself into a situation that can actually cause you disease or death or anything. Usually in medical terms,
That means,
yeah,
that risk mean possibilities, is it?
yes, very good. Risk is a possibility. Hazard is identifying something that is harmful. Risk is a possibility that you can actually die, or you can cause an injury, you can cause a harm, cause a disease. That you need to understand. These two are very distinguished terms. Is that understood what I said? Or do you want me to explain a little bit more? No problem, I can explain. Is it clear? Like I will tell you another example so that you will understand.
The example, can you explain it?
Yeah, so very good. Okay, so I will give another example. Like let's say like suddenly there is a COVID outbreak, right? Now that is a hazard. Hazard means because COVID is an infectious disease, it can spread to anybody. Now the risk is once you identify there is a COVID in your company that is going on, if you don't wear the mask, or if you don't carry out certain hand sanitizer, or if you're not going to get your vaccine, you have a higher chance or a tendency to get the disease. That is the risk. You are in a risk if you don't take proper health precautions or health measures. You are going to be at risk. So hazard is you identifying that there is a COVID disease going on in your company. That is a hazard. You are identifying that is something harmful. The risk is if you don't take proper measures, health precautions, you are going to get the disease. You are in a risk of getting the disease. Is that understood now?
Miss, now we think that electrical hazard is going on. And
Yeah.
fire is the risk, is it?
No, fire is the hazard. Okay, no, okay.
Hazard.
Yeah.
Okay.
Now, for example, let's say somebody said, "Oh, upstairs there is an electric shortage. There is electric shortage. So don't go up, don't go up, don't go up." People are saying like that. There are signs, there are boards, everything. So the hazard is the electric shortage in the second floor. The risk is if you go to that building, even when you have been warned, don't go, you are still going. So you have a risk that you can die because of electricity thing, because of that electric.
Okay.
That's a risk. You can die because of electric shock, because even though they warn you, you still went. That's a risk you're gonna be. So in medical term, we call it morbidity and mortality. Morbidity means when you are affected by you are completely gonna be bedridden, you can't walk, you're completely physically or mentally damaged. Mortality means we are saying that that person dies. That no, mortality and morbidity both are risk, because a risk means something that is going to cause you harm. So when you go to the second floor because of an electric shortage, which is a hazard, you're still going, and when you go, you can either die from an electric shock, or you can completely become what do you call paralyzed by an electric shock. You're completely paralyzed. You are not dying, but you're going to be completely paralyzed. So that's what we call a morbidity. You're unable to walk or do anything. You're just going to be bedridden. But mortality means you're going to completely die because of a particular risk. So that's why you need to understand identifying a hazard that is harmful, and if you don't follow the proper health precautions, that hazard can lead to a risk. You can die or you can become paralyzed if you don't take proper health precautions. Understood, students? Is it clear to you all?
Miss සිංහලෙන් කිව්වොත් hazard කියන්නේ අනතුරක් තිබීම. එතකොට අනතුරත් ඒ අනතුරට කෙනෙක් භාජනය වෙන්න ඉන්නවා නම් ඒකද රිස්ක් එක?
අනිවාර්යයෙන්ම හරියට තේරුම් ගත්තා. hazard එකක් කියන්නේ Tamanට අපි ඒ කියන්නේ සිංහලෙන් කියනවා නම් අපිට එන්න පුළුවන් අනතුරක්. අපි කියන්නේ අපි නිසි පරිදි ඒක වෙනුවෙන් අපිව රැක ගන්න නැත්නම් අපිට අනිවාර්යෙන් ඒක අනිවාර්යෙන් අපිට අනතුරුදායක දෙයක් වෙන්න පුළුවන්. ඒක තමයි රිස්ක් එකක්. දැන් කොවිඩ් සිටුේෂන් එක ගමු. දැන් ඔයා වැඩ කරන තැනක හිතමු කොවිඩ් කේස් එකක් ආවා, නැත්නම් කොවිඩ් ඉන්ෆෙක්ෂන් එක ගොඩාක් හොඳට පැතිරෙනවා කියමු. ඒක hazard එකක්. because එතන අපි දන්නවා අපිටත් ඒක එන්න පුළුවන් ඉඩකමක් තියෙනවා කියලා. නමුත් අපි ඒක වෙනුවෙන් අපි හරියට මාස්ක් එක දානවා නම්, ඊට පස්සේ අපි හරියට hand sanitizer එහෙම පාවිච්චි කරනවා නම් අපි දන්නවා අපිට ඒකෙන් we can survive. අපිට ඒකෙන් කිසිම මේ අනතුරුදායක දෙයක් වෙන්න බැරි වෙන විදියක් වෙන්න පුළුවන්. හැබැයි අපි මාස්ක් එකක් හරි ඒ වගේ දෙයක් අඳින්න නැත්නම් අපිට පුළුවන් මේ disease එක අපිට it can come to us. ඒක risk එකක්. ඔය කියපු දේ ඔය තේරුම් ගත්ත විදිය හරියටම හරි. ඒ කියන්නේ did you understand with the example? අර COVID example එක කියනකොට ඔයාලට තේරුණාද? example එකක් ගත්තොත් කොහොමද ඒක hazard එකයි කොහොමද ඒක risk එකයි කියලා අපි ඒක වෙනස දැනගන්න විදිය තේරුණාද? ඒ ප්‍රශ්නේ කවුද ඇහුවේ? මට මේ නම හරියට පේන්නේ නැහැ. කවුද මේ ප්‍රශ්නේ ඇහුවේ?
සචිනි මිස්.
සචිනි ඔයාලට තේරුණාද? ඒ කියන්නේ
ඔව් මිස් හොඳට තේරුණා. ඔව්.
අන්න ළමයි එහෙම අහන්න. Students ask like that. Ask. Please ask. Right? Ask. That's a good one to ask. Okay, right. And the next one is, the most important part of hazard reporting is that you act quickly and you tell a manager or supervisor who can take action to prevent an accident or harm. It is a legal requirement that you do this. Once a hazard is identified, a risk assessment needs to be carried out. You should be familiar with your agreed ways of working for reporting health and safety risk. So now, for example, අපි කියමු තරංග විතරයි දන්නේ second floor එකේ මෙහෙම electric shortage එකක් තියෙනවා කියලා. තරංගගේ යුතුයකමක් තියෙනවා ඒක අනිත් අයත් ඒක දැනගන්න බව. Even maybe the manager doesn't know that, let's say තරංග just went to the second floor to use the washroom. එයා suddenly දැක්ක wire වල electric sparks වගේ එනවා. කවුරුත් දැකලා නැහැ. Only තරංග is the first one to see. So it's Taranga's duty to immediately go and report to the HR or to the manager or to somebody immediately saying that there is an electric spark. එයා එදා බේරුණා කියමුකෝ. But it is a selfish thing. Just because she's got saved, it is a wrong thing that she doesn't inform. Maybe the next time, again, she could be at risk. Maybe electric shock එක කියන්නේ තව දුරට ඒක දිගට පැතිරෙන්න තියෙන්න පුළුවන්. So ඒකයි කියන්නේ risk එකක් hazard එකක් දකිනවා නම් මොනවා හරි අනතුරුදායක දෙයක් දකිනවා නම් වහාම ඒක මැනේජර්ට හරි HRට හරි ඒක වහාම ඒක දැනුවත් කරන්නම ඕනේ. හේතුව the end of the day you have to protect yourself, your people, and everybody who is working in the place. That's the most important thing. And only then the people who are involved, who are really educated, or who are really knowing how to do, will know what to do. What is the risk assessment that they need to do? That is very important. මේක නිකන් කියන්නේ gossip එකක් නෙමෙයිනේ, කෙනෙක්ගේ වැරද්දක් කියනවා නෙමෙයිනේ. ඒ කියන්නේ තැනක තමන්ට අනිත් අයට අනතුරුදායක දෙයක් තියෙන නිසා ඒක වහාම කියන්න ඕනේ. That's the right. ඒක ඇත්තටම එහෙම කියන්නේ නැත්නම් ඒක ඇත්තටම ආත්මాతකාමී දෙයක්. It's a very selfish thing. So you should try to prevent that. Okay? That is why they say you have to. It's a legal requirement. It's a legal requirement that you do this. Okay? Right. Now, මේ වගේ දෙයක්, this is what I was trying to tell you all. මේ ඔක්කොම පෙන්නන්නේ අනතුරුදායක දෙයක්. This is a very important thing. Then usually අපි driving license ගන්නවා නම් ඒකටම වෙනම signs තියෙනවා. ඒ කියන්නේ you have a curve, bend එකක් තියෙනවා. ඒ නිසා එතනින් පාර ඒ කියන්නේ don't drive on that place. That's why ඒ කියන්නේ සාමාන්‍ය driving license ගන්න කලින් ඒගොල්ලන් හැම sign එකක්ම check කරනවා whether you know. දැන් මේ වගේ skeleton එකක් කියන්නේ ඒක කෙනෙක්ට ඒ කියන්නේ it's a poisonous thing. ඒක බිව්වා කියන්නේ අනිවාර්යෙන් කෙනෙක්ට මැරෙන්න පුළුවන්. ඊට පස්සේ මෙතනින් කියන්නේ usually මෙන්න මේ වගේ දෙයක් කියන්නේ සාමාන්‍යයෙන් මේක HCl වල sulfuric acid වල මේ sign එක තියෙනවා. හේතුව ඒක මොනා කියන්නේ Bunsen burn එක ළඟ හරි තියෙනවා නම් ඒක ගිනි ගන්න පුළුවන්. The whole building can catch fire. So each sign has a symbol which you need to know. දැන් සමහර වෙලාවට තව දෙයක් තියෙනවා. දැන් HR manager හිතනවා මේ වගේ මේ symbols දැම්මා කියලා හැමෝම ඒක ගැන දැනුවත් කියලා. ඒකත් වැරදි. අලුතින් කෙනෙක් ආයතනයකට සම්බන්ධ වෙනවා නම් අනිවාර්යෙන් එයාගේ යුතුයකම, මැනේජර්ගේ යුතුයකම මේ signs මොනවාද මෙතනින් අදහස් කරන එක දැනුවත් කරන්න ඕනේ. සමහර වෙලාවට උගත් කෙනෙක් වෙන්න පුළුවන්. මෙහෙම බේසික් දෙයක් දන්නේ නැති වෙන්න පුළුවන්. හැබැයි we can't judge them, right? සමහර වෙලාවට ඒක නා දන්නව ඇති. හැබැයි හරියටම මොකද එතනින් අඟවන්නේ කියන එක දන්නේ නැතුව ඇති. So it's a must. ඒකයි කියන්නේ employer කෙනෙක් employeeව ගන්නවා නම් අනිවාර්යෙන් එයාට train කරන්න ඕනේ. එයා කිසිම දෙයක් දන්නේ නැතුව වගේ you have to train them. කිසිම judgment නැතුව you have to train because that's their duty. You can't judge anybody because අලුතින් ගන්නවා නම් you have to train them. මෙහෙම දෙයක් තියෙනවා. මේවා තමයි risk assessment, especially healthcare management, right? You cannot then just because I am a biomedical science researcher, like if I have to get something like a medicine thing, I have to say, oh, I know medicine, so I don't need to learn. No, mama eka, even if I know, I still have to be humble to learn everything from the beginning. That is the correct thing to do. Samanyan jivite, we have to be very humble to know, understand, accept our mistakes, right? Even if I am wrong, if somebody corrects me, I shouldn't defend, ne varadi, oya kiyepude varadi, mamai kiyepude hari. Ewa neme, you have to be මේ නිහතමානීව දෙයක් කියනකොට ඒක හරියට දේවල් තේරුම් ගන්න ඕනේ, right? So these are important things. So risk assessment is like assess කරන කෙනා assess කරාට පස්සේ අනිත් අයට දැනුවත් කරන විදිය ඒ හැම දෙයක්ම ගොඩක් important, right? So hazardous substances found in a health and social care environment include like cleaning materials, disinfectant body fluids, right? So for example, if it's a saliva, urine, blood sample, fecal matter, මේවා ඔක්කොම body fluids. හරි ඒවා සාමාන්‍යයෙන් අපිරිසිදු කිසිම කියන්නේ hygiene නැති දේවල්. කෙනෙක්ට තවත් කෙනෙක්ට ලෙඩක් පැතිරෙන විදියක් තියෙන දෙයක් body fluids කියන්නේ. So it's very very dangerous. That's why you need to wear like protective equipments. Medication, like පොඩි ළමයි එතන ඉන්නවා නම් කොහොමද? සමහර වෙලාවට medications can be colorful, toxic ones. Sometimes they can think it's a toffee, they can swallow it. So these are like hazardous things, right? Clinical waste such as dressings, then සාමාන්‍යයෙන් තුවාල වලින් පස්සේ දෙන dressing wounds, plasters, ඊට පස්සේ bandages, those are hazardous. How do we know what kind of bacteria is there, what kind of infections is there, right? Contaminated clothes, contaminated needles, towels, bed lining, right? සාමාන්‍යයෙන් ඒගොල්ලන් කියන්නේ I don't know whether you all have heard, you call it streptococcus and staphylococcus. These are bacteria usually people can get from hospitals, right? Now ගොඩාක් අය කියන්නේ hospitals වල washrooms පාවිච්චි කරන එක try to mitigate. එහෙම නැත්නම් try to carry a bottle of alcohol or like alcohol tissue papers before you sit on the commode seats, because especially like national hospitals, you can't even say private is clean. Usually the cleaners ones are like even within your house, usually you need to disinfect, because when many people use the same commode seat, you can have a tendency to get diseases. That's the normal way. Like you need to wash your hands. So hygiene and clean practices is a must. It's a must, right? To prevent diseases, spread of the disease one person to the other. So these are hazardous substances. So can you tell me, like these body fluids or medication or all these, what does it come under, what hazard? Is it chemical or biological?
Chemical.
Yes, very good. So you could see that we can always identify any kind of hazard based on chemical or biological or environmental, right? So that is very, very important. Okay, right. So these substances can enter the body via inhalation, by either breathing or by swallowing or by the needle stick or by absorption to the skin. So for all products you use, you need to read the hazard information found in the label. This will inform you about their hazard and help you to keep yourself and others safe. That's why usually in the chemical bottle, especially when we were working in labs, usually they train you to read the labels in the chemical bottle. You need to know, is it toxic? Toxic and carcinogenic are two things. Carcinogenic means definitely you can get cancer. Toxic means, for example, sometimes people can find hard to breathe. Now this actually happened to me. Like I was using one day a bleach powder that I bought from Bangkok. I wanted to just clean the sink, and I didn't know that I was actually allergic to bleach. And I really found hard to breathe. So usually the thing is, when you have a bleach attack, you have to nebulize, right? So luckily I knew what to do based on my medical knowledge. I knew what to do. But let's say somebody who has asthma or who has something like emphysema, something like a disease with regard to respiratory, immediately if you have got exposed to something like bleach, you need to hospitalize that person and nebulize them, so that you can detoxify the toxic gases in that substance and give them sufficient amount of oxygen. So that's why, like I never knew. Sometimes people don't even know what they're allergic to. I just knew that I'm allergic to bleach. Like some people are like allergic to peanuts. Sometimes people don't know unless they get that adverse effect. So it's very important, right? To read.
And also miss lung diseases also can happen, no?
Yeah, definitely.
Because of the chemical.
Yeah, of course. See, it can happen through breathing, it can happen through swallowing, it can happen through a needle, it can happen through skin, and it can depend on that situation. We don't know which organ is going to affect a person. Right? සමහර වෙලාවට then accidentally පොඩි ළමයෙක්, just imagine swallowing a thing, how that happen, like or a needle stick, or diabetic patient connector, that patient didn't know that they have a cut, මොනා හරි infection එකක් ගියාම they have a very high tendency to get a sepsis. That's why they say diabetic people, be very careful when you walk on the what do you call, garden, to wear shoes or slippers, because when they have a cut and all, they have a high tendency to get infection, because diabetes it leads to that situation. That's another whole medical thing I don't want to explain, because I might go out of topic. But you need to understand like how these substances can enter the body and what are the ways that can cause a hazard to you. That's why they say always try to read the label of the products. Is it harmful? Is it toxic? Is it cancerous? Okay, is it corrosive? Corrosive කියන්නේ අතේ වදිච්ච ගමන්ම your hand starts to burn and the skin can peel off. Like this happened to one Visakian girl. Accidentally, she was working in a lab and she was using conch sulfuric acid, and without wearing the eye goggles, actually there was a spillage of conch acid to the eye, and that child became blind. Many cases like that has happened, where the skin gets dissolved, හැම යනවා, හැම ගැලවිලාම යනවා, like 3rd 4th degree burns එනවා skins වලට. Like those are very, very scary. So ඒකයි කියන්නේ හැමදේම when you're working, especially with toxic, anything that they give you in life, when they give you something to eat or drink or anything, you must check the label. What is it really? It's a must. even like a gift that you're getting to eat, because you don't know, sometimes those ingredients might have something that is allergic to you. Even if it's a food item that you can still eat, you need to always have that discipline to read what does this label contain. Only then you will know, right? That's very important. Students, so I will just pause a little bit to show you all the Kahoot quizzes answer. Where did I put that? Wait. Yes. Can you see the screen? Students?
Yes.
Yeah, right. So last week, let's just go through the questions answer so that people who didn't get the answer, and I think who didn't join today's session, hopefully you all can watch the recording. So the first quiz I asked was, the three greatest challenges facing India's healthcare system are accessibility, availability, and the answer is actually accountability, right? You need to be accountable. If something goes wrong, you need to be accountable. Who is accountable? Like you need, like accessibility means, like, you know, if there is like short, if somebody is having like, you know, severe fever, people should have the access to have Panadol, paracetamol. But like, for example, Sri Lankan's crisis, children are not having the accessibility for basic Panadol syrup, or even if there's a dog bite, people are not having the accessibility for those medication, or like, you know, antibiotics. And availability and accessibility is quite similar, but it's also different. Like access and available means like every pharmacy will have it, so it's available. Accessibility means how far you can get it, like, you know, so for example, you should have a nearby pharmacy in case of an emergency. You should not have a pharmacy that will take you to go for like 1 or 2 hours. If so, that means your infrastructure of the country is not that great. So like usually if it's a developed city, maybe every next 20 minutes you will have a nearby pharmacy. That is how far you can access. Available is like every pharmacy will have it. And the accountability means like if something goes wrong, there is somebody to take responsibility for it, right? Like if the pharmacy gave the wrong drugs or if they gave the wrong dosage, that person is accountable to take that blame. Okay, that is accountability. So the next question is, healthcare management can be extraordinarily stressful because there is a serious high risk nature in caring for ill patients. So just like how I mentioned like last many times since I started the course with you all, it is a very stressful situation because it's rewarding, but because we're dealing with people and because we're dealing with vulnerable people like pregnant mothers, elderly, old age, and children, it is like, you know, we have to take a responsibility because we're dealing with their lives. So in case if something goes wrong, if we do something wrong, because something that we did that they die, then you know you can get into prison, you know, you're putting somebody's life in danger, you're leading them to die. So that's like why we need to be very careful in everything what we do, what decision we make, what we say them, how we tell them. It's very important. So that's the answer. So who is often recognized as being the first hospital administrator? The answer is Florence Nightingale. So that's like a general knowledge question. So when it comes to healthcare management, Florence Nightingale, you can read about it, right? What is her service and all. Mother Teresa is not really the answer because, you know, Mother Teresa is more into like how spirituality, and that's a different story. So that's just a general knowledge question. You can read about her, how she has given support in terms of healthcare management, right? And a true or false question I asked is, all the information that must be managed in healthcare organization is protected health information. The answer is false. So, for example, I told you age and name and where you live and all that is not a protected information, right? Some things are not needed to be protected, but when it comes to someone's, like if a doctor is trying to take information about a patient, yes, it needs to be private. Nobody should breach it. No one has a right to ask. So it depends on what information it is, right? That's the answer for that. So the answer is false. What question should you ask yourself regarding a potential job hazard? So what are the hazards of the job? We need to, is there specialized training required for this job? Do I have the right to protective equipment for the job? So the answer is all of the above, not just one. Is that understood the question? What question should you ask yourself? You need to ask all of this. Are there any danger for me because I take this job? Is there any specialized training? Right? Do I have the right for protective equipment? So this is a job which is coming with hazard, meaning something that you're working with the lab, or you're working in healthcare management like a hospital or a medical laboratory or in a clinic, right? Something to do related to health. So you need to have the right to ask all these questions, right? Next one. Telemedicine provides a platform for doctors and patients. Why? Because they need to interact, right? Not just to chat and relief and exhibit. They have telemedicine means to interact. Like many, I think in the past we had some doc on call, those I kind of apps. I think now also you have e-channeling and all, where in case a doctor cannot come or you cannot meet a doctor in site or in person, you can do a e-channeling like that. So you need to have an interaction, right? Next question, a health record system must accumulate data and information for all clinically relevant events. Why? Because you need to have, it needs to be observable. Did you all understand this question? It needs to have observable data. Why cannot be clinical, diagnostic, or technical? Why does it have to be observable data? Can somebody tell me? Only 3 still. Why, students? It has to be observable.
We can get the true information.
Exactly. You need to have observable information so that it's true, it is accurate, it is precise, right? That is the answer. Very good. Is it legally acceptable? Is it legally acceptable to perform a procedure to a conscious patient without his or her consent? No, no, no. The answer is no. Even a doctor cannot make a decision, even if the doctor knows that this patient is going to die if the surgery is not done to them. The doctor can always tell the patient, look here, Mr. John or so and so, if you don't do the surgery, you have only 10 or 6 months to live. That is doctor's duty to tell the patient, but it is solely on the patient's duty to make that decision that the doctor can operate. No one, not the patient, not even the family member, cannot make the decision unless the patient is in a coma. The doctor can ask the mother or the father or the husband or the wife, what do you want to do now? If the patient is in a coma, if there is hope that this particular surgery is done for the patient, a family member closely related to someone can make a decision on behalf of that paralyzed or coma patient. But the question here is a conscious patient cannot, no one can do without his or her consent. He has to give the permission. Whether he knows whether he's going to die or not, that's a different story, but no one can operate on him unless he gives the consent. That's a very must. Okay. So it is not, is it legal? No, the answer is no. Last week, I think Fayaz asked, what does ASQA mean? So it is actually Asian Society for Quality in Healthcare, right? But mainly we are studying in the UK, right? So
This question all ask about this question, Miss.
Yes, sorry. Okay, everyone asked. Okay, so the answer is Asian Society for Quality in Healthcare, right? Okay.
All answer America.
All answer America. Okay. So that's the thing. Healthcare is there in every country as per region and as per continent. See, Australian, Arabian, Asian, American, but mostly because OTHM is a UK level qualification. We don't really talk much about other people's healthcare, but understand each and every healthcare follows a legal policy. They have their own rules, but end of the day the objectives are almost the same: protecting themselves and protecting the people, and being transparent and all that. So that's very important, right? The next one is effective management of blank is critical in providing a high quality of healthcare. Is because of what? Financial resources, right? So I told you, even though we have technical, human, natural, all these resources cannot function if there is no proper financial resource. You understand? Now see, like everything, I think I come back to Sri Lanka is because everything is now under a critical situation is because the country is running out of money. So when there is money, when there's a financial crisis, everything that is connected to it, children's education, people's health sector, people's jobs, infrastructure, traveling, petrol, gas, like it's like a cobweb. හරිද මකුළු දැලක් වගේ හැමදේම connect වෙන්නේ මකුළුවා is like the financial resource, like the spider is the financial thing, and the web that the spider makes is all the technical, natural, financial. So if you kill the spider, you will not have a cobweb anymore. So if the financial resource is actually like destroyed, everything else that is connected to it is going to be destroyed. So that's why so much of issues in the country is because that one main thing is now being like really destroyed, right? So that's why everything is a critical, providing for high quality in anything is financial resources. So that's very important, right? So even like you see now why Sri Lanka can't have like proper what do you call transportation services, like even the public transport is still not up to high quality because of the financial resources, right? So children, even to get papers for their exams, no financial resources, so no dollars, everything is gone bankrupt. So the whole thing that is connected to it is also like all destroyed. So the same thing is effective management is mainly the financial resources, right? Then the next one is, without healthcare data information, there would be no need for healthcare information system. Is that true or false? So the answer is true. It's true, right? Without any healthcare data, how can you have a healthcare information system? Anything is data. You need information, right? How do we know to sort of go to this particular place if somebody doesn't give us a direction? I can't say, oh, please come to my house for my get together. I need to tell, come to my house. I need to tell the information on this particular day, this particular time. This is my address. You need to give information for them to come. Just like that, you need to have healthcare data information, right? Next one is, healthcare organization maintain medical records for one primary purpose. No, for many purposes. Financial purposes, for the HR purposes, for many purposes. Like we learned a lot of policies also, right? Why so? And we studied about record keeping. Why do you need to keep record keeping, right? So a lot of things. And the next one is, legal documentation is considered the number one reason for maintaining patient records. Yes, that is also a false thing. Because why do you think it's false, student? Is only maintaining the patient's record you need to have legal documentation? Why is it false? Somebody can you volunteer and answer?
We need other information also.
Like what?
That name and other things also not a legal thing, no?
Yes. So like not just only for the patient records, you need legal documentation even to maintain financial status, right? And also for health risk assessment purposes. Like patients, yes, they are the main thing in the sector that you are looking and working for. But you need legal documentation for because understand a sector or a department has lot of roles, HR role, financial role, you have what you call operational role. Like if you take a company, you have so many sectors. Now, when I work in clinical trial, we have a department just for auditing. Then we have the HR department. Then we have the operational department who looks everything about clinical trial. Then we have the financial department who is in charge of, salary declaration, all those things. So, you have legal documentation is not just for the patients. So even though I was working in a hospital, I have patient records, not just for the patient's purpose, but because I need to report to the sponsor, I need to report it to the HR, because when we give incentives to the patients, I need to tell the HR, okay, I need this amount of money because the company gives us money to give the patient. So we need to show proof. Otherwise, we can cheat and take that money instead of giving the patient. So that lot of transparency, right? That's why you need legal documentation. right? And the last question, healthcare information systems and healthcare process are closely entwined with one another. Actually, it is true, right? It is true because everything is an interconnected process. Like you need this and both of them are interconnected. It is a true thing. Anybody has questions? So last week, all of y'all wanted to know the answer. So I thought instead of just sending the answer, it's better that I discuss as well why this is right and why this is wrong. Is that clear, Taranga and the rest of the people? Is it any questions that you didn't feel clear enough with my explanation? You can ask me.
Yes, Miss. Now clear. With the timing, we can't answer the question, Miss.
Yeah, so
When we are playing.
yeah, don't worry, Taranga, because Kahoot is usually they give only 20 seconds for a question. That's the way the quiz is. I mean, even I cannot change the time. It's usually 20 seconds. That's the way the platform operates. So don't get disheartened if you didn't get answer. It's just for like how to say, just an interactive session. So end of the day, even if you got it wrong, if you know why it is wrong and what is correct, that's all that matters. Because
Now I get it, Miss.
very good. Yeah. So don't worry. Try also to get yourself a little bit, I mean, practice with the time, even if you all are not having a assessment, MCQ questions. So in the future, I don't know what your life plans are, where you all are going to head. You will have a lot of exams if you all go further, where you will need to manage your time because Kahoot is something like a British American game. So always the time is what they limit when it comes to exams. So it's okay, don't get upset. You don't have any MCQ questions, you just have only essay questions. But like what I really want is active participation, because some of y'all get the opportunity to speak in English, some of y'all get the opportunity to express in English. So make use of this time, and you will also feel like y'all are understanding better when y'all discuss. And it's interesting also to talk, and always your opinion, your feedback is always welcome. Then I also know what are the areas I need to improve further to make y'all understand, right? Only when y'all give me your opinion and feedback, I know where it needs to work, right? So that is that. So I think maybe we could do one more slide. It's almost now, I think, 5 for y'all, no? What time is it, Taranga? There? I think it's 5. Yeah.
5.
Right. So let's just do one more slide, and then maybe we can stop. Yeah. So we learned this. Yeah. So next one is about first aid, right? So usually, can you all tell me where does a first aid function? At what situation do we have first aid? In one
accident.
Yes. So do you think a first aid is important only in hospital and in workplace?
When hazards happen at home also.
Very good. Mama, can I mama kiyanne, like actually I feel like very good if everyone knows basic like things when a situation arises, like have to have a first aid at home, very important. Like by now some of you all already know what are your diseases, like bamaneta wage nang domperidone, headache nang Panadol, plasters, Dettol. If it's infection or like anything like basic drugs, always. I think when I was a child, we were like trained in school to have a first aid in our homes, and I think ever since then, I really believe that's a very good habit to actually get into our lives. Very important. Actually, even if you can't make a fancy first aid box, even a box where you can. But the best thing is you need to methodically organize. Pills, plasters, like that, where you can compartmentalize and keep it. So first aid is something that needs in every place. Even when you're traveling, you carry a small first aid with you, your home, your office, anywhere. Accidents can happen anytime, any moment, any location, any place. That's life. It's unpredictable, right? So accidents and sudden illnesses are caused by the risk found in a particular workplace, any place I would say, and risk assessment should be available which identify all the potential risks and steps to reduce the likelihood of them happening. No matter how much we try to be protected, life is uncertain, like life is unpredictable. We never know. Like we say destiny, we say so many things. It's true. So what we can do is We could just have as a safety precaution in case something goes wrong, how we can act, right? So potential accidents could include slips, trips, falls, sharp injury. It could be an accident, right? Something like a sharp object, cutting us, something entering our skin, something we ingest or we drink or we inhale. When you talk about dangers and hazards, harmful thing that can happen to us are so plenty. We can go on about it even for 2 hours. So many things that can happen, right? And burns, like that can happen. I think past 6 months ago, like many gases were getting, gas burns people were having, right? So burns can happen, right? So where injuries arising from accidents, the nature of health and social care means that individuals may have existing condition which can cause sudden illness. So like I said, for example, I never knew I was allergic to bleach. So, and I think I'm a little bit asthmatic, which is why I got allergic to that situation. So sometimes people don't know they are allergic to peanuts until they are eating the peanuts. So that's why there are situations, or sometimes people who already have it can become aggressive. Like, for example, they already have a very bad, a gum boil in their mouth. And the moment they ate the seafood, it became worse. So that's why that you need to be aware that what you are actually susceptible to get sick and, infected, so that you avoid that situation. Is that understood, students, what I'm trying to say? Yes.
Yes,
So,
Miss, first aid is like that using our common sense, is it?
okay, common sense also. But like once now the common sense is okay, you need to take a Panadol when your fever is high. But what if you don't have Panadol at your home? What would you do? You need to have like common sense is, yes, knowing that this is the situation. And the next is how you act. So having, what I'm saying is, have a first aid so that when a situation happens, you have the resources to go back to sort of, protect yourself from that situation. So, when you have a fever, you will need to take Panadol. But if you also have Panadol in your first aid at home, you can, quickly take it. You don't need to waste time going to the nearby pharmacy, running to a pharmacy. That's what I'm saying. First aid is like, like certain common things that you will need to have: plasters, bandage, a surgical spirit, Panadol, your thermometer, if you're dehydrated, if you often get dehydrated, you have like Jeevani, like those kind of things, you maintain a first aid with the common basic medications, which you feel like you'll need commonly. And also, of course, common sense, like when I tell somebody saying, okay, second floor, don't go, there is an electric shortage, the common sense is you do not go because there is a hazard there, and if you go, you will have the risk of dying. That is common sense. So it's both interconnected.
And also, Miss, now when we are there's an accident. This is example.
Mhm.
So accident is happening. So we are I am there. So I am going near to and I am going to help him. We don't have the gloves, no, Miss. Say then we can use something else.
Yeah, that's fine. That's fine because
That is common sense, no?
yeah,
That's what I asked.
yeah. Now the big another common sense more than the gloves is like, let's say somebody is getting electrocuted, right? Now the common sense is, when we were children, we were taught you do not go and touch the person who is getting electrocuted because you also can get electrocuted. So what you do is you take a wood stick or a broomstick, which is like a wood thing, and you actually try to make him get away from that electrocuted thing. So the common sense is you knowing that you do not touch a person who is already getting electrocuted. You use a, what you call a wood-like object so that you are protected, right? That is a situation. How you think of acting. Or for example, another thing, you do not touch with wet hands. You do not go and switch on an electrical equipment, because we are taught from small days you need to touch any electrical thing when you're switching on a plug or switching off the plug. Your hands are dry, because the moment it's wet, your body can conduct electricity and you can get an electric shock. So common sense is how you decide, how you think on basic situation. And a first aid is you have basic things stored in a box. When a bad situation arises, you have access to them. If you are having fever, you have access to Panadol because you have opened a first aid in your home. You have a plaster or a bandage in your first aid box in your home when you have a cut. So how you have a first aid is what I'm trying to explain here, and why you need a first aid. And of course, you need to have common sense when you go through a situation, how you act on it. Right? Is that clear?
Yes, first aid means first action.
Yes.
You are taking.
Yes, first action you're taking, but you need to have the equipment stored in those first aid boxes.
Okay.
Yes, yes, yes. Anybody else who found it unclear? I can explain, or is it okay? I have almost lost my speed by talking. Is it clear, students?
Yes, miss.
Okay. So I think we will stop the session. It's almost, I think, past 5. And I think we had a good session, even though we had few students today. So you all asked questions and you all gave your opinion, you all discussed, very good. Try to be more interactive in the next class also. And I also gave you all the answer for the Kahoot quiz. So hopefully we will have more students next week where we can watch the video and also have another Kahoot quiz based on this lesson. So I put a message to the group. Other people can watch the recording. If you all have any questions, any doubts, please feel free to ask me via WhatsApp, or you can ask me in the next session. And so that's it. So any other questions, or can we end the session now?
No, miss.
Okay. Okay, students, then have a great Sunday and a great week ahead. And all of you all stay safe. And I'll see you all next week then. Okay?
Thank you, miss.
Okay, bye. Take care.
Thank you.